I want to start by saying something that may surprise you. I am not against knee replacement surgery. In fact, there are situations where it can be the right decision. But every week I meet people who have been told that surgery is their only option. These people are scared. They're frustrated. These are people that feel like they're running out of time. And many of them have never been told that there are other options that may help them before they commit to a life-changing procedure. So if someone has told you that knee replacement is your next step, I simply want you to hear another perspective before you make that decision. Maybe this sounds familiar. Your knee hurts when you get out of bed, or you dread the stairs. You avoid those long walks. You find yourself looking for the closest parking spot. Maybe you've stopped traveling. Maybe you've stopped exercising, or you've stopped getting down on the floor with those grandchildren because you know that getting back up, it's gonna hurt. The hardest part isn't always the pain, it's what the pain takes away from you. Your freedom, your confidence, your independence. And when you've tried injections, medications, braces, therapy, and you're still hurting, surgery can start to feel like that's your only hope. Knee replacement surgery has helped many people, and there are absolutely situations where it can be the right decision. But it is still a major surgery. Recovery can be lengthy. There are risks that are involved. And while many people are happy with the outcome, it's important to understand that success is not guaranteed. Some people continue to experience the pain. They continue to experience the stiffness, the limited mobility, or even complications from such a major surgery. The other reality is that once the procedure is done, there's no going back. Your natural knee is gone, and it's gone for good. That's why I believe that every person deserves to fully understand all of their options before making that decision. Again, not because surgery is bad, but because surgery should be chosen from a place of confidence, not desperation. You should know that you've explored all of your options. You've asked the questions that need to be asked, and you feel at peace that this is truly the best pathway for you. One of the most common things that I hear is, Dr. Wootton, they told me that I'm bone on bone. And many people hear those words and immediately think that surgery is unavoidable. But here's what most people are not told. The amount of arthritis seen on x-ray does not always match the amount of pain that that person feels. And I've seen people with mild arthritis who are miserable. Pain is more complex than just a picture. Inflammation matters, joint function matters, muscle strength matters, blood flow matters. The body's ability to repair and adapt, that matters too. That's why some people are able to improve significantly even when they've been told that they're still bone on bone. In fact, let me tell you about our patient Becky. 3 years ago, Becky was told that she needed a knee replacement, and she was about a month away from having that surgery. Her knee pain had become so severe that walking was difficult. She wasn't sleeping through the night, and every step seemed to remind her that something was wrong. And like many people, she believed that surgery was probably going to be inevitable. But before moving forward, she wanted to explore all of her options. Today, 3 years later, Becky still has not had that knee replacement surgery. She enjoys walking. She's able to stay active and do the things that she loves. And one of the biggest victories, she's sleeping through the night again. I share Becky's story for one reason. Not to tell you that everyone's going to have the same outcome, but to remind you that sometimes there are options that are worth exploring before making a permanent decision. And you owe it to yourself to know what those options are. Now, I want to be very careful here. Not everyone can avoid surgery. And I would never tell someone to just ignore medical advice. What I'm saying is this: if you're considering knee replacement surgery, make sure that you've considered every reasonable option that's available to you first. Because if there's a chance to improve your pain, your mobility, your function, your quality of life without surgery, wouldn't you want to know? We've seen people return to walking, return to gardening, return to dancing or traveling with their friends and family, return to playing pickleball or even cornhole with their grandchildren. Not because we performed a miracle, but because we help support the body's natural healing process. And we address the factors that are often overlooked with patients. If you're watching this and you've been told that knee replacement is your next step, I want you to hear this. Don't make that decision because someone convinced you that there were no other options. Make the decision because you've explored all of your options. You've asked all the right questions and you feel confident that this is the right choice for you. And if surgery ends up being the best path, you'll move forward with confidence, with a peace of mind, knowing that you've done your homework. But if there's another option that could help you delay surgery, avoid surgery, or simply improve the overall condition of your knee pain, you deserve to know about it. Your knee matters, but more importantly, your life matters. The ability to walk, to travel, to play with grandchildren, to stay independent, to enjoy the things that you love. That's worth exploring every reasonable option before making that life-changing decision. And if you'd like to learn more about the options that we explore for chronic knee pain, click on the link below or call our office. We would be honored to help you determine whether you're a candidate and what options may be available for your situation.